received a consignment of antiretroviral medication from the UNITAID, which is a global initiative partnering on treatment of major diseases in low and middle income countries. Now, to support this move is to support the ongoing efforts to suppress HIV and AIDS and optimize treatment for children with HIV and AIDS. Now, the consignment was received by Health CAS Dr. Mwangangi. David Kasembeli now reports.
The aid that was received by Kenya comprised of 47,000 packs of DTG in 50 milligrams, donated by United Nations agencies, and 28,000 packs of DTG in 10 milligrams from UNITAID through the Clinton Health Access Initiative.
Children and adolescents have for the past 3 years been put on optimized regimens such as DTG to ensure faster viral suppression is achieved, as we seek to ensure that all infants born to HIV-infected mothers have access to prompt HIV diagnosis and treatment, and those infected are treated to ensure longevity and good quality life.
The newly formulated drugs flavored with strawberry were received by Health Chief Administrative Secretary Dr. Mwangangi. These drugs seek to optimize treatment for children living with HIV and AIDS in the country. Speaking to the media while officially receiving the donation in an event held in Nyumbani Children's Home in Karen, Dr. Mwangangi said that the drug has fewer side effects, adding that patients are less likely to develop resistance to medication.
Imagine you're a mother or a father of maybe 3-4 children, and one of them is on this regimen, another is on a different regimen, and you're having to administer a drug to your child, and your child is crying, is not taking the drug because the drug does not test good, it doesn't have good compliance. Imagine then giving this mother something that the child actually looks forward to. There's one gentleman and woman who told us, these days, the child is one who reminds me it's medicine time. And that's profound, because that means the child is now taking an initiative in their own care and treatment. It means that the child will then be able to continue taking the drugs and will comply, will gain weight, and will have good outcomes.
Studies show that DTG-based regimens have high potency, a high genetic barrier to HIV drug resistance, low toxicity, and have fewer drug-to-drug interactions. Evidence supports using DTG as a preferred first-line ARV drug for children and teenagers living with HIV and AIDS with approved dosing and people co-infected with TB. In total, about 106,807 Kenyan children below 14 years are living with HIV, but only 72,968 are on treatment. In 2019, 4,333 children succumbed to the disease, being 11% of all HIV-related deaths that year. In 2018, the World Health Organization recommended DTG for children over the age of 4 weeks and weighing more than 3 kilograms, but to date, only those weighing 20 kilograms or have access to medication due to lack of age-appropriate formulations get the drug. Currently, there are approximately 1.5 million people living with HIV in Kenya, out of which 106,807 are children, and of which 1.2 million patients are on antiretroviral drugs. 68,011 are children below the age of 15. David Kasembeli, Look Up TV, Nairobi.